Hello everyone, I'm Neela Patel. I'm a second year Geriatrics medicine fellow. My research is focused on yoga as an exercise intervention for older adults, and that's why we have this topic for presentation today. I will be mainly focusing on what is yoga, what are the different types of yoga, what are the benefits, and why is yoga important as an exercise intervention for older adults. Then I just generally want to even emphasize, even if it is not yoga, just exercise in older adults and how important it is to make sure that older adults exercise. And I've been doing a systematic review as a part of my research in the second year on yoga interventions in older adults, and I'm going to analyze the review material that I have and get a manuscript out of it. So I'm going to discuss some of the findings of that with y'all. And then finally, what are the benefits of yoga? Yoga is defined in many ways, but the most simplest meaning of yoga is union or merger. And in the broadest sense, yoga basically means harmony, biostasis or homeostasis if you're talking in terms of medical terms. The concept of yoga is based on the fact that each individual body is multi-layered and is made up of 5 different layers. The layer that we are seeing outside is what we call as the physical layer, or it's our physical body. The breath that we take is the energy layer, is one layer within. The mind is the mental layer. The rationality, the ability to make difference between right and wrong or make rational decisions, is the intellect. And the final innermost layer of perfection is the spiritual layer. So as I defined or I mentioned in yoga that in a broad sense it means harmony. The essence of yoga is basically to attain a harmony in all these 5 layers. It is to attain balance and self-enlightenment. Now, yoga can be achieved in many ways. I will be discussing the different types of yoga. I think it's in the next slide. But basically through posture or poses or asanas, that is mainly the physical yoga. Through breath, part of the breath is controlled even when we are doing the physical poses. Your breath tends to get streamlined and your inspiration and expiration is more controlled when you're doing the physical yoga. But you can also just focus only on the breathing, which we call as pranayama or breathing exercises. And relaxation and meditation are more towards the spiritual or getting in touch with the innermost layer in yoga. You can relax even with just doing physical postures and breathing. And you do a part of meditation in the last part of the physical yoga, what we call as shavasana or the dead pose. But to reach the highest level of harmony where you're reaching the innermost layer for spiritual, it takes years of practice, and you never know when it happens, it happens. So the different types of yoga are hatha yoga, where you are forcing your body to get into certain positions, or you're making up your mind to get into that pose. That is the most common form of yoga that's practiced here in the United States. The hatha yoga itself is of many different types. You have the Iyengar yoga, you have the Ashtanga yoga, you have the Bikram yoga, and these are named after people who have followed certain principles in practicing this kind of yoga. For example, the Iyengar yoga is by a person by name Iyengar, BKS Iyengar. He's 92 years old, he's still alive. He has a yoga institute in India, and he has a yoga school and certification that he manages here in the United States. But his yoga is specifically related to, he thinks that every body is made differently, physical body, And so you cannot standardize the physical poses to each body. So he uses props, and I will show you pictures later, where you can use belts, blocks, chairs, bolsters to make the pose more comfortable for the body based on what the physical body is. The other form of yoga is jnana yoga, or yoga of knowledge, which all of us are doing. Okay? We are gaining knowledge in our own fields of interest. Karma yoga is skillful work, or any work, just even homemakers are karma yogis. So everybody who's working for something or the other is a karma yogi, is focusing, concentrating on that work. And bhakti yoga is the yoga of devotion. This does not necessarily mean just going to church or temple or praying, but also means being devoted to whatever you do. So even if you're doing the physical yoga or hatha yoga, or even if you're, reading, you're working, but you're being devoted or committed to whatever you do, that also classifies as bhakti yoga. So yoga, I wanted to just highlight how very similar the aims of yoga are with the definition of health as defined by the World Health Organization. Both yoga is also very broad. Both yoga and the definition of health is very universal, and both have a lot of similarities. The ultimate goal is spiritual perfection. Maintaining a balance in physical body and mind, and life force body and mind. Okay. So before I talk about what are the guidelines for exercises in older adults, I just wanted to say that there are some myths that the National Institute of Aging has found on exercise for older adults. Older adults think that exercise is for younger people, that they need to go to the gym or have special equipment to exercise. They cannot do it at home, and everyday activity, whatever they do, is not considered as exercise. They think their bodies are too frail, they may break some bones, and that exercise was for them when they were younger and not as they age. And also they think that if they exercise, they may hurt some muscle or break a bone, and that would take away their ability to continue their everyday work. So these are statistics that we've got from the National Blueprint for Older Adults, that by 2000 there were, more than 13% of the US population was over 65. And this is going to increase to 70 million in 2030. And almost 5% of the population in 2050 is going to be more than 85. So now the focus is not just on people above 65. The focus is also on older folk. The importance of exercise in older adults is because many of them are sedentary. Majority of them have a chronic health condition, and sometimes it's multiple comorbidities. And because of the comorbidities, they have chronic disabilities, and they have difficulty in carrying out their daily tasks, their activities of daily living, and their instrumental activities of daily living. The number one reason for institutionalization of older adults, or getting them into long-term care facilities, is them losing their function, their ability to do the activities of daily living. More than 2/3 of people above the age of 65 do not engage in regular physical activity. This was by the BFRSS, that is the Behavior Risk Factor Survey, on a national basis that was done, and these are findings from that. And majority, as I said, do have chronic diseases which interferes in their maintenance of muscle function. But the key is this, that even though they have these chronic diseases, exercise has actually a positive impact on the condition that they have, and not a negative impact. There are disparities in who exercises in older adults. Men exercise more than women, and the women who least exercise are basically black women. We don't have much literature for Hispanic or other older adults from other cultures. And of those who exercise, the NIA has found that patients who've been advised by their primary care providers tend to exercise. But research has shown that less than 50% of older adults report that their physicians advise them to exercise. Okay. So the types of exercises that the National Institute of Aging recommends for older adults are basically endurance exercises, flexibility, strengthening, and balancing. Balancing includes both flexibility and strength. The endurance exercise, actually we do have data for younger adults that 30 minutes or 150 minutes a week. There's really not much research done on older adults as to what is the best exercise prescription for them. But having done review of literature, the NIA has concluded that at least 30 minutes for 3 to 5 days will help older adults. Okay? And they recommend that they do need to stretch every day, and strength training should be there for 2 to 3 days in a week, and balance. The strength and flexibility is what constitutes the balance. I will show you the exercises that they do recommend. Walking, swimming, even enjoyable activities like just dancing, and common work that they do at home, like raking the leaves or doing yard work, climbing stairs. All these counts towards exercise. You don't exclude this. So you're going to encourage them to do even just yard work or climb stairs. In bad weather, they don't have to go out. If they have stairs at home, they can just climb stairs as a part of their exercise. Now, many of the exercises, we see a lot of it in television too. The chair exercises are good, especially for strength and flexibility. Just lifting smaller weights, and they don't really have to buy weights to lift. They can use filled in Coke bottles or water bottles as weights to lift to start off with. They don't have to, and then so whatever is there at home they use. They don't have to buy any special equipment to do the exercise. All these are chair exercises which can easily be taught by a physician in the office. I know we all are crunched for time, but maybe you have a visit just scheduled to educate them on this, or in waiting rooms have videos and material, or somebody be offering this in waiting rooms to educate them as to what they can do at home. Every time I see the waiting room in the GEM clinic, I wonder, it's such a waste of time. You have family, caregivers, and you have the patients, and nobody's doing anything about making use of that time to educate them. They also encourage things like yoga and Pilates for strengthening exercises. And exercise can be done anywhere. Okay. Again, these are chair exercises. Now, the reason I'm showing these pictures from the NIA book is many of these postures are very similar to the yoga poses that we practice in the Hatha Yoga. Okay. So just playing with grandkids out in the yard, doing some yard work, shopping for groceries, all these count towards exercise. Just encouraging them to even do this, if not just going for a walk or specifically going to the gym or specifically doing the chair exercise, but just participating in these activities itself contributes towards their exercise for the day. The question is, who needs to exercise? Is it those who are already active, who do bike or walk or swim, or is it those who are sedentary and with chronic disabilities and comorbidities? Is it the obese or the frail? Who do you think needs to exercise?
Everybody.
Everybody, yes, that's the right answer. It is everybody. Everybody needs to exercise. Even those who are osteoporotic, kyphotic, have a risk of falls and fracture, you do have to encourage them to exercise, because that's actually going to help them rather than cause them more harm. So coming back to yoga as an exercise intervention for older adults, The yoga as an exercise intervention, yoga basically follows the principles that were written by Patanjali. Okay, and the principles are called as the Yoga Sutras. Okay. These were all written down by him, and each of the posture, the form of yoga, whether it is yoga of knowledge or devotion, it follows these principles. Okay, and I specifically want to discuss the Iyengar yoga today because that's the kind of yoga that I am interested in my research, and which I feel, and research has shown, is suitable for older adults just because it uses props. It goes at a pace that's comfortable for the individual who's practicing it, and even doing it for a short amount of time, they do have benefits. So basically the Iyengar yoga follows different poses, and today's session I'm just focusing on the physical form because we're using it as an exercise intervention. The postures we have are standing postures, sitting postures, inversions, twists, forward bends, and backward bends. Okay. This is the simplest version of the standing posture. You stand on your feet with pressure on your whole foot, that is the toes and the heel and your sole perfectly together. It's not just that you're focusing on your toes or you're focusing on your heels. It is pressure all over. And we use this block to hold it tight so that the pressure is equally distributed on the foot. This is called as the mountain pose. You're raising your arms up. Here, basically you're stretching all your muscles to the maximum length. And believe me, this requires energy. Nobody is dressed for a yoga pose now for me to ask you to practice it. Even if you try it, you know it. And then you keep moving the block up to the knees and then up to the groin where you hold it tight, because that opens out your spinal muscles and pushes your coccyx down. So many of them who have a back pain, it releases the pressure from the back and it helps them out. So you keep changing it, and this is the most basic beginning standing pose that we start with. We use belts, which is another prop, a yoga belt, and we use a belt in all different variations and combinations, but here I'm just showing it for how it is used for upper extremity flexion and strengthening. You initially start off far and then slowly go on nearer.
Is it the elastic?
No, it's not an elastic belt, it is a cotton. Just like our gait belts, what we use the gait belts for physical therapy, it's that way. I'm sorry, I really wanted to bring a block, a belt, and a bolster, but I changed cars this morning.
But when you say you start out like this, and then you just, as you stand there,
you try to work it up, and see, because initially when you take it up this way, you're going to put your hands at the back. So you need it to be wider, and then you try holding it closer and then move at the back without bending your elbows. You're going to see that in the next picture here. This is just to improve even the flexibility at your elbows and shoulders. And this is holding it nearer and then bringing it up is more difficult than holding it further up and bringing it up. So this is the ultimate goal where you want to reach.
So that standing will kind of help with the kind of spinal stenosis kind of patient for this particular, what things help?
This basically helps to open out the chest, okay, and it also helps improving the flexibility and strengthening your muscles of the upper extremity, the shoulder, the elbows, the wrist, the arms.
The one before this one is you stand up and then you try to get on your toes. Is that what you're trying to do?
No, you don't get on your toes at all. You keep equal pressure on your entire foot, the toes and heel and the base of your foot.
You raise your arms and try to get like a stretch backward, or?
No, you just hold it up straight. You stand like a mountain, hard, firm. You don't move.
Okay, that's it.
Okay, that's it. You're just stretching all the muscles to their maximum limit.
So you do it multiple times, like down, and then do it again? And
Yes. You stand for a couple of minutes, and then that streamlines your respiration, You start focusing on your breathing, and by doing this, you are focusing internally within yourself. You know, you are so engaged in focusing on the pose and in stretching all your muscles, the external environment doesn't affect you. That's why this is the starting point for going within. And that's my main interest, that yoga as an exercise intervention has much more to offer than just the benefits of physical exercise. It goes beyond just the physical benefits. Okay. So this is what we do with the belt. This is just to improve the flexibility and movement at the shoulders. The wrist. Actually, we're supposed to do it with our hand. Even I can't do it.
Everyone's trying that.
Okay.
I'm not dressed for it.
Now this is another where we use the belt to stretch the hamstrings and the muscles of the lower extremity, and then to open out the hip. Many of them are tight at the hip, and that's where their gait imbalance is there, and they tend to fall more. So we use a chair to go up slowly. You know, you don't have to go right high up in the beginning. You go slowly. Yeah.
Like somebody doing straight leg.
This person, the reason I have his pictures here is he's a retired surgeon. He's had 3 times hip surgery because the hip replacement did not work for him. He was totally dependent on his wife to drive and for everything. And now he drives her around. And this is like, I think 3 years now, this is his 3rd year of doing yoga, but in the 1st year of doing it, he was with a hunch, he could not walk, he was using a cane for support, and he just wouldn't drive because he had no control.
What places in San Antonio do they have that type of yoga?
There are a lot of them actually. The Synergy Studio has a lot of them who teach this kind of yoga, and the San Antonio Yoga Studio teaches this kind of yoga.
Is that one here?
Yes, this is in San Antonio Yoga Studio. This is the San Antonio Yoga Studio. And there in the picture behind you see that's Dr. Perkins, that's his wife.
So, is this something that, like if you wanted them to get started in this and then you sent them off to some yoga place, would they know to find this type of yoga? I mean, or would the other ones be harmful to him and the other types of yoga?
The other ones won't be harmful, but the thing is the other ones seem to be more challenging, especially the Ashtanga yoga, because that's more like a power yoga. And the Bikram yoga, they heat up the room to 105. Okay, and so it's really not very comfortable to be doing that. And in the Ashtanga, it's more like a flow. So there's nobody to help you if you don't get into that pose. They just give you the instruction verbally, and they ask you to go from one position to another. You know, just like an aerobics, they keep changing from one exercise to another. So this initially, for those who want to start with yoga, it's better to go on a one-to-one, do some sessions by yourself alone with the teacher, and then you go into a general class.
And so some of these places,
In some of these places,
one-to-one,
yeah.
right?
Especially for older adults. For people like us here, and you can go into any class. You'll pick it up. You know, especially if you go to an Iyengar yoga-based class, they will see that they fit you in.
Is it relatively inexpensive, or what's the cost for, patients?
It's much lesser than the copay what they have to pay for insurance, because I think the class cost varies from, if it is an individual class, it's anywhere from 35 to 50, I think. But it depends if it is an individual class, if it's an individual general class without any specific disorder, it's much lesser. And then when you go into the general class, I think it's anywhere from $8 to $10 in the general class. Here again, the use of a block here we're working on the muscles of the back, and you're also working on the hip. So the instruction when they are sitting is not to lean on one or the other hip, but to sit on both the sit bones, and the pressure is on the blocks from the palm. So that included a twist too. The previous slide included a twist too. Okay. This is the partial forward bend. Now this person couldn't do a forward bend standing, and so then the teacher adapts to his body and makes him do a forward bend sitting on a chair. The forward bends not only focus on the muscles at the back, but they also focus on the abdominal muscles. Now this focuses just stretching, flexibility, focusing on your muscles of the spine, neck, everything. Many of them try to hold their neck in this position, and it all depends on what instruction you get from the teacher for doing the pose. This is called as the triangle pose, and this is like the king of all the yoga poses. Mm-hmm. If you attain, you're comfortable in doing this pose, you really benefit maximum muscles in your body with this. There is like a physician in India, in Chennai. He's an internist, but who's also been trained by B.K.S. Iyengar, and he's doing yoga research. And he's done ultrasounds and echocardiograms of the heart to see how yoga as an exercise affects the heart. And he does yoga therapy for different conditions. He's got a sequence of poses that he's been doing. He mentions that in this pose, the patient gets the maximum benefit.
Even though it's adapted, not the...
Yeah, even though it's adapted. Yeah, so that is, I'm glad you bring that point up. That is the key. It doesn't mean that you have to go right down. It doesn't have to be the externally perfect pose. It has to be the internally perfect pose. So you adapt it. It's more, the key is to align your spine and see that the spine is not hurt when you're doing this poses, and your muscles need to be stretched in the correct. You don't need to harm your muscles in trying to get down there. Even those who've been practicing for years will still use a block or a chair. It doesn't mean they're not good at it. That's what their body requires them to do. And this is again a partial forward bend. Usually we would use the wall for support at the back to raise up that leg, but he cannot go up to the full pose yet, and so he's using chairs for the pose. This is where the relaxation begins after you do the poses. And you start with using the bolster, or you could use a chair. And the key in the relaxation again is to make sure that the spine is straight and the muscles of the spine that have been stretched are now relaxed. So that's what you focus on in relaxation. So you can use the chair or the bolster, whatever is more comfortable. And then this is the final dead pose, where you're just letting go of your body from head to toe.
If they could just rename that pose.
Then they call it, the Shavasana means, because your breathing is really, it's very slow in this pose. And if you get into this pose and you're really not aware of the outside, we've had sometimes people don't come out of it for a while. It takes a little while for them to come
What's
out.
the name of the pose?
The near-death
Shavasana.
experience.
Shavasana. Shavasana. Shav means dead. Okay. So the goals for exercise, whether it is yoga or just any form of exercise for older adults, is start where the patients are. For those who've been active, and you can give them 30 minutes every day of endurance and stretching every day. But if they aren't and they are sedentary, then just start with 1 to 2 exercises and then progress slowly. As they make progress, you can keep adding more until they make it a permanent habit. And include activities they enjoy. As I've shown pictures and mentioned, that it doesn't really have to be that 8 to 9 they have to exercise, or not make it a routine, but in things that they are doing every day, if they can incorporate exercise, yard work or grocery shopping or playing with the grandkids or anything. And choose realistic goals. Yeah, you know that they have to reach 30 minutes a day for at least 3 to 5 days in a week, and they need to stretch every day, but that's where you want them to reach. But for them right now is not the right time to do that. So teaching the exercises correctly and safely. So making sure, it's not a bad idea to have them go to physical therapy with specific goals, to go there to learn the things to do the right way, or to a yoga class, and monitor and chart progress. In San Antonio, there are some places which have specific classes for people above the age of 50. They do. I think Synergy Studio has yoga for above 50, and Shambhala has yoga for above 50. That's in downtown. I know there are quite a few places that
Where
have.
is the San Antonio Yoga Institute?
It's in Hilatus.
That's what I thought.
Yeah, it's a beautiful place.
Yeah, it's a perfect place for it.
Hilatus, yeah.
Right.
I mean, it's actually not. Yeah, it's 3 miles out of the loop, 1604.
Yeah, that's right.
Build up exercise and activities gradually, and make sure you include all, not just the endurance or not just strength and balance, but you include everything, and reach the goal. You know they need to do it for 30 minutes, but you can start for 5 to 10 minutes, and it doesn't have to be 5 to 10 minutes continuously, especially if it is people who are more frail, who cannot stand it for longer. You can break it down. And then when they are ready to progress, you first increase the amount of time of each activity that they've already learned to do, and then the difficulty of the activity. And make sure that they stretch after they've done some endurance exercises, and tell them to breathe, not hold their breath. So basically the goals for exercise, if they're currently inactive, then begin small and gradually increase. If they are active but not as much as they should be, then you encourage them, praise them for what they're currently doing, but tell them that they are still not there. You need to, this is your goal, and come up with a plan. And if they are active, then just encourage them to do it and not stop. There are a few reasons that keep older adults from increasing their physical activity, but too old and too frail are not among them. So we do have certain contraindications and cautions for exercise, especially given that our population has a lot of comorbidities. And these are some of them: severe aortic stenosis and aneurysm, if there are any EKG changes that have been recent, any unstable angina. So it's mainly heart related, and of course the metabolic syndrome of uncontrolled hypertension or diabetes. Some for resistance training, especially like lifting weights and all that, a hernia that's causing them symptoms, or foot or ankle sores that don't heal. Many of the times our patients come in with shoes and socks, and we don't remove that every time in the office, and it's only when you get the reminder for diabetic and all, and then you realize that the patient is having a sore there. Any severe shortness of breath, oxygen dependent patients, doesn't mean they cannot exercise, but then you have to go very slow with them. So the benefits of exercise, we know, is for all chronic diseases. The chronic care model came up with the prevention, exercise as a preventive tool. But the yoga goes beyond just the physical benefits of exercise. It even helps calm the mind. Research has shown helps even mental. And then the concept of having a yoga class together is like brings people in together socially. Some of the poses help with depression and mood disorders. It does help to connect within even if you're just doing the physical form of yoga, you're focusing on your body and you're focusing to go within it. Seems to be healing at every level. So because of this and my interest in yoga, I am currently doing a systematic review of literature in yoga, specifically for older adults. And the search terms are used for yoga, aged or elderly or older adults in English, and then I've put the limits in certain databases for age above 65 and 80 and randomized controlled trial. The databases I searched were PubMed, Medline. Although they say both of them are the same, we got different number of articles when we searched in PubMed and when we searched in Medline Ovid. So overall we had 115 articles, and when we searched for randomized controlled trials, we got 34 articles. We specifically looked for articles which had only subjects or participants above the age of 65. So there were a few articles which had subjects above the age, from 40 above, and they did not have separate data for just above 65. So we excluded them from our review. Web of Science gave us 34 articles, and which was very similar to what we got from the PubMed. Scopus gave us 89 articles, and Scopus gives even those from non-peer reviewed. So if it's like in a newsletter or in a magazine, you do have it. Eric, we got only 4, and Pedro, which is like an Australia-based, we got 9 articles for older adults. So 2 of us are now, we are done with reading the abstracts. We are now actually reading the articles and getting ready to get the tables for doing a meta-analysis. So longitudinal studies were, including the RCTs and longitudinal studies, 7 of them, 7 of them included pre-post intervention or matched controls. All of them were age 65 and above, included both male and female. They had healthy diabetic, cancer patients with mainly breast and prostate cancer. Most of them were in the community, independent living or living in assisted living. The number of participants for each of these studies varied from 11 to 153. And of course, there's the most recent one, which I have not included in this, was one that was published in the Journal of American Geriatric Society. But that one also has a sample size of, actually it's 50. It's 26 and 25 in each. Majority of the outcomes studied are outlined here. It was mainly for pain and function, sleep, depression, most of them based on quality of life. There was one on cognition and dementia and how it affects diabetes control, cancer, stress symptoms of cancer, and not the cancer per se. It was more like coping mechanisms once they had the diagnosis of cancer. Pain was the most highly studied. Pain, function, quality of life. The outcomes, we broadly divided them into like physical, physiological, psychosocial. They basically decreased falls, they improved gait, and decreased pain. Participants in various studies reported improvement in sleep and cancer symptoms. Improved quality of life, their functional status improved. They were able to participate more in ADLs and IADLs. Mental, there was just one randomized controlled trial that was funded by the NIH, and it was just a study that was for 6 months, and they did not find much change in cognition, but they found a change in quality of life. Studies did show improvement in depression and mood disorders. Fatigue was much less anxiety, and better self-esteem. There were a couple of studies which also studied on the spiritual aspect and sense of well-being and quality of life. So the take-home messages, these are given by older adults themselves. It's a savings account, so just you're investing when you're exercising. keeps you independent for longer. And no one is too old to enjoy the benefits of regular physical activity. So I had done a systematic review earlier, and it had stopped at 2007, and I was surprised that at that time I just had 9 studies, and now 2 years later when I did the review again, there were so many randomized control trials more, so that was really good news. But still, it's like smaller samples, so I don't know if we can really generalize all what you find from those samples. But it is specific to older adults just above the age of 65, so that's good news. So thank you all, and I'm open to questions. This is what Namaste actually means. Yes.
What about using exercise for cardiovascular health? I mean, I can see yoga for stretching and balance and flexibility and that sort of thing, but surely the other component is cardiovascular health. And do you need to incorporate yoga with another exercise program which does that?
No, actually when you do yoga, you will realize your heart rate does go up. And that was what Dr. Raman in Chennai has done. He's done these echocardiograms and the ultrasounds of the heart just to show that your heart rate may not go up, but it still offers the benefit. And it's not that your heart rate doesn't go up at all, it does.
Well,
It's
there's
a
that
workout,
one
you
too
sweat
where-
out and everything, even when you do a full
It's that
class.
one where you come up and you do the salute to the sun and then you go back. And that one's hard. You know, where you get all the way down and you have to get all the way up and do a salute.
Yeah.
I tell you.
I think I'm not sure of the benefit of I mean, yoga is good and everything, and maybe improve the quality of life, well-being, and all that stuff. But to really prove that yoga is better than just any regular exercise, I think it's very hard to prove that, especially thinking about medical benefits, objective medical benefit. I think it's very hard to prove that.
Yoga is compared to what?
Compared to regular
Such as?
exercise, gym exercise, or aerobics.
You're going to get your 70 or 80
80-year-old
to
to
do
go
that?
do it.
That's why I'm
Walking, things like that,
But this is more than walking,
Yeah,
though.
this
It's
is more than
stretching
walking
and
and-
I know theoretically it sounds
They lose
very
a lot
nice.
of function because they stop stretching and they lose their flexibility, and that's why they have the contractures and all that. So
I
this is
try
an
to-
intervention
But how
where
can
they're
we
still going to
prove
be
that?
independent.
How can we prove this is really?
That's what most of this literature has shown so far.
I think
That
it's
it's
showing
improved
there's a-
their
I mean,
function.
yeah, I
and their
understand. I'm not
quality.
against it, but I mean, to say that really it improved the cardiovascular system and cognition and things like that. I mean, I think it's taking it beyond the point. Maybe depression, maybe it may increase the feeling of well-being and things like that. That's maybe true. But I mean, to take it to the point of improving your heart and improving your cognition, make your dementia get better. I think it's very hard to prove that.
Well, I don't think they did.
That's
as well.
very hard to prove even with exercise.
No.
The only reason I said I'm comparing yoga with exercise is I think yoga has more to offer than just the benefits of exercise. It goes beyond just the physical benefits of health.
I think another endpoint you could look at is how compliant they would be. I can see more of my patients sticking with this because it's less impact and they would get a lot of benefit from the stretching than I could see them even trying it and not even trying something else,
With a belt and a block at home,
Yeah.
they will be doing this
So it's like
themselves.
use a
And
treadmill,
I-
walk 5 miles.
Yeah, or I don't need you to start using
Or even
Bowflex.
pool is low impact, but
Right.
access and then who wants to get in
Yeah. And then they're further going to slow. I mean, there's so
Yeah.
many reasons why they don't go. But this I could see that you could do safely even in your own home, and you could feel safe doing it as an elderly
in person.
Where do we sign up?
Right.
I can send you all an email with all the yoga studios in San Antonio.
That one in the Lotus looks really pretty.
See? Good
Thank you.
There are 3 classes in the one in Lotus. The have a person who owns